I'm here to talk about Cassini, the cornea specialist company. We are pushing the envelope, driving innovation in measurement of the human cornea, the window to the world. And the human cornea is a refractive surface. Its primary role in life is to focus light. And so it makes sense to measure it with light directly, to measure the refractive capability of the front surface and the back surface of the cornea. And we can do all these things in the clinic to help prevent refractive surprises, those unwanted outcomes, reducing the number of unhappy patients. And that has been the focus of our technological innovation at Cassini. Total corneal analysis means measuring both the front surface and the back surface in every patient for better intraocular lens power calculation and better correction of astigmatism, whether with an intraocular lens or with a femtosecond laser-guided arcuate incision. Recently, we have also moved into the area of ocular surface diagnostics, dry eye. And I'm going to talk more about that in a moment, but it's important to realize that in order to measure the refractive power of the front surface of the cornea, that front surface is the tear film. It's not the epithelium, it's the tear film. That's where air meets water, and that's where the eye first refracts light. Poor quality tear film means a poor quality measurement. And we are driving forward the idea of measuring the quality first before obtaining the measurement. Iris registration for laser surgical guidance. We can map the iris to the laser for accurate placement of arcuate incisions for the correction of astigmatism. This creates an integrated surgical workflow from the clinic to the operating room and back to the clinic for outcomes analysis, where we can do data mining for population characteristics which benefit the individual surgical practice, but also benefits industry by looking at product utilization and practice trends. And finally, we can provide proactive clinical solutions, pushing the diagnosis of dry eye downstream to the optometry office, to the referral network, where diagnosis of dry eye and ocular surface problems can be made, treatment can be initiated before the patient gets to the surgeon with the disappointing results that, no, we have to wait 6 weeks while we treat your dry eye. We can now push that to the referral network before that referral ever gets made. Cassini works through a GPS-like map of the anterior corneal surface using an LED array of multicolored lights and second Purkinje point-to-point ray tracing for measurement of the posterior surface. And here you can see how those measurements take place. It's very user-friendly. Technicians can acquire measurements in less than a minute. And this is the fascinating result of mapping the anterior surface for quality of the tear film. Because we use individual multicolored LED reflections from the tear film, we have implemented software that can actually look at the quality of each of those hundreds of reflections, whether they're bright and crisp and clear, or whether they're smudgy and blurred. And the smudgy and blurred points obviously correspond to those areas of tear film insufficiency. And remarkably, you can see the result of dry eye treatment, going from the pre-treatment scan with these broken spiderweb patterns to the perfect scan where all the dots are connected. That means every one of those reflections is perfect and allows this kind of analysis of the tear film. So now we have gone from corneal refractive diagnostics into corneal health diagnostics and an analysis of dry eye like virtual fluorescein staining, non-contact, patient-friendly, which enables diagnosis of tear film quality. We have partnered with multiple companies in the ophthalmic space, including an IOL manufacturer in Europe for preoperative diagnostics and toric IOL selection, with Lensar, the femtosecond laser company, which is set, by the way, to emerge stronger than ever from bankruptcy with their strategic partnership with PDL, and has instituted a program, peer-to-peer counseling and on-site visits, moving forward the growth of the premium channel by investigating, isolating, and diagnosing and treating those roadblocks in individual ophthalmic practices which inhibit the growth of the premium channel. With Leica, the microscope company for toric IOL guidance and verification, and finally, post-op analysis and surgically induced astigmatism management in the clinic with back calculation and perfection of IOL calculation formulas. Briefly, the iris registration is sort of miraculous as the laser integrates the image from Cassini, rotates the eye to account for cyclotorsion, and then delivers the arcuate incision, improving outcomes dramatically. And Cassini, as a result, has seen tremendous growth over the past quarters in implementation of these scans. So for refractive cataract surgery, for surgical guidance of femtosecond lasers and toric IOL placements, and in the optometry office for diagnosis of dry eye disease and contact lens fitting,